Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 2 of our course in the principles of staff and patient education. And we had a very nice week of discussion. Once we finally got the Blackboard to open up for us. Monday we were pretty much locked out of Blackboard, so everybody had a little bit of extra time to do their discussion question responses. And well, most of my participation in class this week was really just getting to know you more in the staff introduction, or excuse me, in the student introduction area. And then, of course, we also had a very robust and a very nice discussion on the different roles of staff education and staff educators. In reviewing these discussions, I was very pleased to see that most all of you really are looking for nursing education is your most likely career path, that this is where everybody is either currently working in or where everybody is pointing to. And so we have a really good wealth of information, a wealth of experience in this class that I think is going to make our discussions really lively. So a very good week of discussion. And a nice jumping off period to our second week of class. We're going to move from specific roles of nurse educators to a little bit more specific points. And this week, the discussion is going to primarily focus on how state law and continuing education requirements and how each state has different requirements for continuing education. And that was a little bit of an eye-opener for me. I kind of figured that having practiced most of my life, most of my professional life anyway, in California and being pretty much California specific in my framework, I figured that every state had a 30-hour requirement and that any 30 hours would do, but actually it's all over the map. Depending on the state that you practice in, some states don't have any continuing education requirements at all. I'm also licensed in Arizona. In fact, my primary license is in Arizona right now. Arizona is a member of Nurse Compact, and so I'm actually licensed in a number of states. But Arizona doesn't have any continuing education requirements. All that's required is to show that you've worked a minimum of 1 year within the last 5 as a nurse somewhere. And if you have experience as a nurse, no need for continuing education. I'm also licensed in Nevada. Nevada has a 30-hour requirement every 2 years, and Nevada is also required that everybody has specific training in bioterrorism response. So I have to complete a bioterrorism training before I could be licensed in Nevada. Other states have requirements for sexual assault training and for abuse training. So just realize that really different states have different requirements. And so this is going to be a little bit of a review of that. You're going to be reflecting on that this week. And the discussion question itself is that you're going to examine the Nurse Practice Act of 3 different states, specifically examine the continuing education requirements listed in the Nurse Practice Act, and then talk about how there are similarities and differences and how this influences the role of nurse educator in a clinical setting. There is also some reading on the ethics, some ethics review from the Bastable text, and also talk about clinical nurse education and the some important things that you need to know for being a clinical nurse educator, some of the legal liabilities. So that can be included in your discussion question response as well. Remember, in week 3, you have your first paper due. Your leadership paper is going to be completed and submitted by next week. By the way, all written assignments are always going to be due on Sunday of each week, even if it says Wednesday or if it says Friday in the class. I've got to go through and review. But the discussion question, your initial response is always due on Wednesday. 2 follow-up responses, different days of the week on Saturday. But your written paper is always going to have those due at the end of the week. I figure it's only fair to give everybody the full week in an online program and not say that we arbitrarily end at Friday and make you turn everything in on Friday. Give everybody to the end of the week, and then I take to the end of the following week to go ahead and get everything graded. So I think that that's only fair and kind of works out that way. So I look forward to participating in class with you once again this week. Look forward to seeing everybody, and I shall see you in the discussion forums.